And on behalf of IHMA Kerala State Chapter, I welcome you all. And this is the season 2 of free webinar conducted by IHMA Kerala State Chapter and by the remembrance of our master, Dr. Samuel Handyman. We can start the session. And dear delegates, please make sure that make the fruitful use of all webinars because we cannot upload all recordings in the YouTube because some recordings may consist of information of patients. So I request all delegates to make fruitful use of all webinars. And today we have Dr. Shajahan with the topic Scope of Homeopathy in Autoimmune Diseases. Dr. Shajahan is working in is a homeopathic consultant in Fatima Medical Center in Alain, and he is a former teaching faculty member in Nehru Homeopathic Medical College, New Delhi. With immense pleasure, I am welcome Dr. Shajahan for the session. Welcome, sir.
Thank you very much.
Full screen ആക്കിക്കോട്ടെ ഡോക്ടറെ. പറ്റുന്നുണ്ട് സാറേ. ഫുൾ സ്ക്രീനിൽ തന്നെ പോവാം, അതാ നല്ലത്. ചെറുതാ അതുകൊണ്ടാ. ഓക്കെ ഓക്കെ.
Thank you very much. And I am very thankful to IHMA for inviting me to this spectacular stage. I am very grateful to you all. And this I wish you everybody a very good afternoon. And good afternoon timing, we know, very difficult for something to learn. This is not at all a good time to learn something. This is meant for relaxation and refreshment. Anyway, since the volume of IHMA seminar is going on in very high peak, so we don't have any other option. So come back to our topic, autoimmune disease and scope of homeopathy in autoimmune diseases. When I selected this topic, I just thought that whether it is relevant or not, because there should be some relevance for speaking about anything, unless it may not be much useful. And you all know that this is a very relevant and hot topic nowadays. Lot of autoimmune diseases are coming up day by day, and in general we have very good scope in treating autoimmune diseases. We can very well treat and we can make very good results in autoimmune diseases. And in main medical system, they won't have much treatment, treatment without suppressing the immune system. They cannot handle autoimmune diseases. So our scope is again getting increased. So what is meant by autoimmune diseases? These are conditions arising from an abnormal immune response to a normal body part. It's an abnormal immune response to a normal body part. Immune system mistakenly attacks our own body parts by thinking that some of our body parts are enemy, and they detect that some of the body parts are going to harm our body, and they think that some of the body parts are intruders. In that way, they may attack our glands. They may attack our joints. They may attack our nervous system, and they may attack our connective tissue. And so on. We know about the immune system. Actually, what is meant by immune system? Immune system is very important thing for any living organism. It is the immune system which protects our body from all the outside intruders, from all the pathogens. It is nothing but the immune system which protect our body. So this is the host defense mechanism. It will detect all pathogens from the point of entry into our body itself and try to fight with that pathogens, and it will try to prevent by all its means to prevent the entry of such pathogens into our body. It may be a virus, it may be a bacteria, it may be a fungus, it may be a parasite, etc. So basically our immune system consists of 5 kinds of cells and 3 proteins. So what are the 5 types of cells? These are B lymphocytes, T lymphocytes, natural killer cells, eosinophils, and monocyte macrophage system. These 5 kinds of cells plus 3 kinds of proteins. What are the 3 kinds of proteins? They are cytokines. We call it as signaling proteins. Cytokines, antibodies, and complement proteins. So these 3 proteins and 5 cells together constitute our immune system. Out of this cytokines, I told you this is the signaling protein. As soon as some pathogen enters our body, these cytokines will give signals, will send signals into our body so that the T lymphocytes, B lymphocytes, macrophages, and the natural killer cells, phagocytes, everything will come together into the, everything will flow into the site of infection. Just like the movement of our army, navy, and air force into the point of attack. So they will try to protect the entry of the pathogens by means of 2 kinds of reactions, 2 kinds of mechanisms. One is innate immunity. Part of our one is called innate immunity, and the other one we call adaptive immunity or acquired immunity. The innate immunity, we know it is present in all the living organisms. It is because of the innate immunity, everybody is protected. Every living organism is protected because around this atmosphere there are n number of pathogens, viruses, bacteria surrounding us, but that cannot enter our body and that cannot do any harm to our body unless and until our immune system is compromised. Understand? So first of all, this innate immunity, it is present for all the living organisms, including plants and all animal kingdom, all living organisms. When we and this is a first line protection for the body, and at the same time, this is not at all a specific thing. It is a non-specific defense mechanism. Whoever is entering, we will prevent, we will protect our body. That is the theme for innate immunity. But acute immunity or adaptive immunity is a qualified one, and this is a sophisticated mechanism, and it is present in all jawed vertebrates. Jawed vertebrates, in fact, constitute good majority of the animal kingdom, including human beings. So, this because of adaptive immunity, we will retain the memory of the attack of some organism previously happened. That memory we will keep in our mind, and body will retain its memory in antibodies, in the form of antibodies. When such organism re-enters our body at any time, body will start an aggressive form of reaction, so that we will be in more safer side, and more easily body can overcome the attack of that organism, second attack of that organism. So this is a sophisticated mechanism, and this is present not in all individuals, but in humans it is there, and generally jawed vertebrates, jaw vertebrates having jaw. And here a question arises in the context of the current corona infection epidemic. We are forced to hear a lot of discussions regarding homeopathy, whether homeopathy, what you are doing, how homeopathy preventive is acting, immune booster, how it is acting, whether will it act on the innate immunity, or will it increase the acute immunity. Actually, acute immunity is the form of vaccination. All are aiming for that. Whether we are we are telling that by mistake we are increasing adaptive immunity or this acute immunity, no. But my answer for this particular question is, homeopathic medicine will help first to improve our innate immunity. That is the first line defense. At the same time, it may help to enhance and to form the acute immunity as soon as possible and as good as possible. That is the reason people who are taking homeopathic medicines will not get frequent infections. This is a fact. This is a proven fact. This is proved by thousands of doctors, homeopathic doctors, and millions of patients. This is a proven fact. So, these are the immunological cells, natural killer cells, lymphocytes, B lymphocytes, T lymphocytes, neutrophils, and monocyte system, macrophage system. This is a simple explanation how it taking place. When a pathogen enters the body, B lymphocytes, so cytokines give signals that a pathogen has entered our body. So the B cells and all our weapons will move towards that pathogen, and B cells will engulf the antigen. This is detected by the particular antigen possessed by each pathogens, and it will engulf, it will swallow that pathogen, and inside this it will break down and it will show the antigen of the intruded pathogen in its periphery. So our T cells will get a chance to attach with these antigens, and it will again alert all of the rest of the immune system. And finally, this will break down into, B cells will break down into plasma cells and memory cells. We know plasma cells will release lot of antibodies into the bloodstream, and that will go and attach with the pathogens antigen and form antibody complexes and destroy the antigens, the pathogens, yes, antigens. And that is how some pathogen is getting destroyed in our body. And what these memory cells are doing, these memory cells, that is the key point for our acquired immune system. So this will keep the memory of that pathogen, that pathogenic antigen in its cell. And at any time in the future, if the same pathogen enters our body, this will violently react. This will multiply and it will release a lot of antibodies immediately, so that that pathogen could be conquered quickly. So this is the action of our immune system in short. So come back to our, but what is happening in autoimmune diseases? So this is normal immune process, immune mechanism. But in autoimmune disease, our body's immune mechanism wrongly detect some of our body parts.
Slide change ചെയ്തായിരുന്നോ?
ഞാൻ ചേഞ്ച് ചെയ്തോളാം.
ചെയ്തായിരുന്നോ?
ചെയ്യുന്നുണ്ട്. അവിടെ കിട്ടുന്നില്ലേ?
ഇപ്പൊ മറ്റേ ഇമ്മ്യൂൺ സിസ്റ്റത്തിന്റെ സംഭവം കിടക്കുന്നത്, അതാണ് ഇപ്പൊ ഉള്ള സ്ലൈഡ്.
അതെ അതെ, അത് തന്നെ.
ഓക്കെ, കണ്ടിന്യൂ ചെയ്തോ. ഓക്കെ,
ഇപ്പൊ മാറിയോ? നോക്കിയേ,
ഇപ്പൊ മാറി.
So this is what is happening in autoimmune disease. In this one slide itself we can understand, because of viral infection, antibodies have been formed in order to counter the viruses. All right, so that antibodies, what they are doing is they will attack virus. At the same time, similar proteins they find similar antigens they find in the myelin sheath, and they start attacking myelin sheath of our nervous system, and that is how Guillain-Barré syndrome develop. See, this is the mechanism happening in autoimmune disease. Instead of countering virus, the antibodies we already formed and the antibodies we are storing as our powerful weapon to fight against the viruses or bacteria or any pathogen, mistakenly attacks. They attack similar antigens wherever present in the body and damages our system. This is called autoimmunity, and this kind of antibodies are called autoantibodies. Now, there are at least 100 types of autoimmune diseases identified so far. 100 types of diseases identified as having its pathogenesis as an autoimmune process. When we see the statistics, we are very sorry to tell that in our country, there is a statistical department is this is not well developed. So there is no statistics, there is no networking between the different health care systems, centers, I mean. So lack of statistical data. So we have to depend for anything and everything for US statistical department. As per US statistical department, about 24 million people are affected in the United States, and it constitutes about 7% of population in the United States. So we can expect more or less similar kind of prevalence in our community also. In India also, we can expect 7% or more than 7% of autoimmune cases. So the prevalence is not bad. And women are more commonly affected than men. Why? Because women are more commonly affected. This happening during the time of pregnancy, or after the pregnancy. Many are getting autoimmune diseases. What could be the reason? Definitely, during pregnancy, the presence of baby, our body's immune system may be trying to counteract and detect. There is a chance that to detect the baby as a foreign element, and body, we know, produce a lot of hormones in order to suppress our natural immune system. That's why during pregnancy, our normal immune system will be in a suppressed state. There is chance of getting many infections during that stage. So pregnant ladies should be always very cautious, because their immunity will be in a lower state in order to protect the baby. This is a natural mechanism. So after the delivery, when all this process, body is trying to come back to the normal body position. So some errors may happen, and this may lead on to the formation, lead on to the establishment of some autoimmune diseases. That could be the reason why women are more affected with the autoimmune diseases than men. And we know it quite often it starts during adult age. This is a chronic disease, clear cut. This is a true chronic disease. It it runs a long course. It starts during the adulthood, and it can run a long course, and it is capable of destroying our organs and sometimes our life itself. But children are also prone to get autoimmune diseases, but the frequency is less when compared to adults and women. History. So knowing history is always interesting. We know the concept of autoimmunity has developed around 19th century, and the first written document published by a French scientist, Metelnikov, in 1900. What he was doing, he was doing experiment with the spermatozoa of guinea pigs, and he inject the spermatozoa of guinea pigs into the bloodstream. So immediately body detected spermatozoa as a foreign antigen and produced antibodies, and these antibodies kind of antibodies, they immobilize the sperms. So sperm immobilizing antibodies it produced. So this was the first written document by any of the scientists. In this regard, we must remember that immune system, humans start thinking about immune system and understanding about immunity means some kind of process existing in our body which can prevent the disease. So the ancient literature written understanding of such an existence of body's resistance power we can see in very back to 300 BC. So first humans detected in Athens when plague was prevalent there. They found that some people who have recovered from plague are not getting secondary infection. So they understand that they are getting a particular resistance power. And they recruited these people who are recovered from plague for nursing other plague patients. So they understood that there is a resistance power is developing in the body system from some acute infections. And it happened in plague of Athens happened around 300 to 400 BC. And it took long 2000 plus years, maybe 2400 years or 300 years to develop a concrete scientific theory. Till that time, it was just a concept. From a concept into a scientific theory, it took long 2300 years. In this context also, we have to tell our critics, please wait, please give us time, because it can happen in modern science. It can take any number of years, centuries, no complaints. When we study the history of electricity, maybe 3000 years before, fishermen in the Nile River while fishing, they got shock from this fish, electric ray fish. And they know that this is dangerous and we are getting some kind of shock. And people understand that they don't touch, they are not supposed to touch such kind of fishes. But Faraday took how many years to understand and make a scientific concrete theory of electricity? Maybe more than 3500 years. So everyone in this universe is getting time, but nobody, so-called scientists, are ready to give homeopathy for enough homeopathy system to give enough time to prove its scientificity. Okay, let it be there, and we can take it as a challenge, and we are not going depression from such comments. And when we come back to the history of autoimmune diseases, so first a written document came out in 1900, and after that in 1904, Donath and Landsteiner described circulating autoantibodies in paroxysmal cold hemoglobinuria. We know the paroxysmal cold hemoglobinuria is this is the first recognized disease in human being. First recognized autoimmune disease in human being is paroxysmal cold hemoglobinuria. This is a condition where especially children get hemolytic anemia following an acute viral infection. And they get all the symptoms of anemia like pallor, jaundice, and dark urine. That is why this name, hemoglobin passing in through the urine, and it gives a dark color for the urine. And it happens when this child got exposed to cold temperature, and otherwise it won't happen. When a previously ill child from viral infection get their body exposed to cold environment, within 2-3 days they will get hemolytic anemia, symptoms of hemolytic anemia like pallor, jaundice, and dark urine. This is a very rare disease, but this is the first detected autoimmune disease in human beings. And why this is happening? The antibodies which body formed to fight against the particular virus is mistakenly detecting the RBCs. Similar proteins are present in the surface of RBC. So they start attacking this RBC by considering that this is an intruder. So so that's how the hemolysis happening. Destruction of RBCs and which lead on to hemolysis. And in 1938, Damschek and Schwartz, they established the autoimmune basis of acute hemolytic anemia. And we know we are studying Robert Coombs test, we are very familiar. In 1945, detected circulating and surface antibodies in hemolytic anemias. And the use of sensitive serological techniques led to the demonstration of autoantibodies, more and more autoantibodies in several diseases and even in a proportion of healthy individuals. So that is how this number of diagnosis of more and more number of autoimmune diseases happen. This is through our technology, especially serological techniques, by which we can identify the autoantibodies. And also pathological study, biopsy study of the organ affected. In both these ways, we understand clear-cut understanding of the pathological process of the disease we got, and more diagnosis came up with the autoimmune diseases. So a lot of criteria were proposed whether to decide whether it is a true autoimmune disease or a just hypersensitivity reaction. So what are the criteria? These are the criteria. Number one, elevated level of immunoglobulins. That means antibodies. Elevated level of immunoglobulins. Number two, demonstrable autoantibodies. That is very important in autoimmune diseases. Demonstrable autoantibodies. And deposition of immunoglobulins at the site of lesions such as renal glomeruli. That means wherever it affects, we'll find immunoglobulins, particular antibodies. And accumulation of lymphocytes and plasma cells at the site of lesion. And these are the cardinal vital steps of autoimmune, immunological destruction. And a genetic predisposition. Because one patient affected with one kind of autoimmune disease in their family, if we say, there can be same disease or similar disease in their family. So a genetic predisposition is very important. Causes. Again, the cause is generally unknown. That is very important. That statement is very important because in almost all chronic diseases, when we see the cause, when we search the cause, the first sentence will be cause is unknown. And still, this is a scientific system. There is no cry from any side that this is unscientific. No, this is perfect scientific system, but the cause is not unknown, and we are not. In fact, this is our teachers also. These are our textbooks also, and we accept and we follow these books also. But the thing is, whatever unknown to the what all things unknown to the modern science or modern developed medical science. There is no problem, no worries, and no comments from the so-called scientists who stand outside the medical system, and even for those the so-called new gen critic who have evolved from our homeopathic fraternity. So they don't have any difficulty, they don't have any frustration by knowing that most of the disease cause of our diseases when we study the literature, most of the disease cause is unknown. That may be the first statement. And in fact, for those diseases, for viral diseases and bacterial diseases, how can they explain that it affects one person and it will not affect the second person? That also how this is happening. If it is a true science, that should affect all, or it should not affect anyone. But it's affecting even viruses and bacteria. They are affecting here and there some people and leaving out many people without being affected. So if they want explanation for something, they are bound to get explanation for many things or everything. Okay. Second point is familial. So the autoimmune diseases, we can see a familial history like lupus, for example, lupus and multiple sclerosis. These are true autoimmune diseases which can be found running in some families. And number two, infections. We already saw Guillain-Barré syndrome, how it is developing. And the rheumatic fever, we know it developed after streptococcal throat infection. So infections are definitely a cause for the production of autoimmune process, or for the onset of or triggering this autoimmune process, or infections are reasons for which led towards the formation of this autoimmune process. And number three, environmental factors, sunlight, UV radiation. This is very evident that UV radiation will cause dermatomyositis. And genes, that's also not completely sure that what are the genes causing particular diseases, but definitely that could be there. And it is more evident in case of type 1 diabetes and rheumatoid arthritis. In some such diseases, scientists are almost find out some genes. And definitely chemicals and pesticides are a reason for many diseases, and it is true with autoimmune diseases also, especially rheumatoid arthritis. Chemicals and pesticides, very important reasons. And drugs, lot of drugs, for example, hydrazines, hair dyes. So be very cautious. Nowadays, usage of hair dyes are very common. Very rarely people does not use, keep away from hair dyes. And most of the people now want to be very young till 100 years. That's good, but they must know that hair dyes, for that they are compromising their immune system. They may get autoimmune disease at any time, because these hair dyes are very prone to induce autoimmune processes. And hazardous waste means especially this radioactive substances, and of course mercury, such type of waste may cause autoimmune diseases. And industrial emissions, that's a common cause for many diseases. Pathophysiology, how the autoimmune process start. This is very interesting to learn about how this process is start. When the human immune system produces T cells and B cells, they produce some self-reactive T and B cells also. And this self-reactive role of this self-reactive T and B cells are they will damage our own organs and tissues. That's why they are called self-reactive T cells and B cells. So this is being produced, part of the production of T cells and B cells. When body produce lot of T and B cells, some cells will be self-reactive. But body has a very keen mechanism to tackle this self-reactive T cells and to reduce its number and to cancel, deactivate the self-reactive T and B cells. Number one mechanism is they are either killed prior to becoming active within the immune system. Number one, they are being killed. So body will detect this self-reactive T cells and B cells before getting activated, and it will kill and it will be killed and removed from the immune system. Number two, it may be placed into a state of anarchy. That means it can no longer detect any antigen. And number three, it will be removed from the role from the immune system by a kind of cells called regulatory cells. With these three mechanisms, body will control self-reactive cells. But if any of this mechanism fail, then definitely number of self-reactive T and B cells will increase, and gradually that will cause the production of autoimmune system. And another interesting feature is this self-reactive T cells are being destroyed mostly in the thymus gland. We know how many persons may lose thymus glands because of some infections, acute respiratory infection, and some other reasons. Thymus gland may get enlarged, and immediately it's been removed. But if we lose thymus gland, it may be a great big impact in our immune system. Similar thing happening for the tonsils also. This is very easy to remove a tonsil and reduce, and patient can be then there won't be any tonsillitis. If there is no tonsil, then how tonsillitis can happen? In order to get rid of tonsillitis so quickly, deciding to remove the tonsils. But tonsil is one of the important lymphoid tissue in our body. So our immune system will be compromised, and it is losing some organs. It's one of the vital portion in the immune system. So losing thymus or losing tonsils cannot be justified so easily. What are the signs and symptoms? In general, we can see fatigue, low-grade fever, general feeling of unwell, malaise, muscular aches and joint pains, rashes on different areas of the skin. These are more general symptoms. And what is meant by low-grade fever? Low-grade fever means temperature from 37.6 to 38 38.4. This is called a low-grade fever. And general feeling of unwell and muscle pain and rashes. We know that rashes in different diseases like SLE and some other diseases. So, but all the symptoms are not present in all the 100 autoimmune diseases. No, some symptoms are more prominent in some diseases, and in some diseases there won't be any symptoms at all. For example, this alopecia areata in some cases are autoimmune. And in alopecia areata, patient will not felt fatigue or fever or general feeling of unwell or muscle pain, and nobody will complain muscle aches and joint pain just because of alopecia. No. But on the other hand, see SLE. SLE patients will get all this, or rheumatoid arthritis, full-blown rheumatoid arthritis, or SLE, or such kind of diseases. Fatigue will be too much fatigue, and fever from low-grade fever to maybe fulminant infection in SLE in some cases because of secondary infection like pneumonia or nephritis, and severe muscle pain, severe joint pains, muscle aches, and rashes. So all this will be there. So that means depends on the organ affected or organs affected or areas of the body affected. This may vary. But in general, if a patient is too much tired and feverishness, when we check, fever may or may not be there, or always complaining of here and there pain, aches and pain, we must consider the possibility of some autoimmune diseases. Now, what are the areas affected? The prime areas affected in autoimmune diseases are blood vessels and connective tissues, joints, and muscles. In blood system, usually red blood cells are affected. Skin, another point of affection. And of course, endocrine glands like thyroid and pancreas. Thyroid, pancreas, and adrenal glands. So no gland is left out. All it's prone to affect almost all glands. Diagnosis: complete blood count. When we see the complete blood count, we say leukopenia, that is reduced number of WBCs, and erythrocyte ESR will be always high, most probably high, and complement level will be low. C-reactive protein will be high, and anti-nuclear and other immune markers. This anti-nuclear antibody is a very important immunological marker in autoimmune diseases. Now let us see some of the important autoimmune diseases. Number one, type 1 diabetes. Here, what is happening in type 1 diabetes? Insulin is produced by the beta cells in the pancreas. So here, antibodies develop against this beta cell of pancreas, and immunological reaction and destruction of beta cells of pancreas will take place with the help of CD4 T cells and CD8 T cells and auto antibody producing B cells. So all this will come activate and come join, unite, and start destroying beta cells. Actually, all these guys are supposed to help our body by preventing and fighting against the pathogens. But in case of type 1 diabetes, unfortunately, they detect beta cell as our enemy, beta cells of pancreas as our enemy, and try to attack beta cells and destroy beta cells. The and we know the main hallmark of type 1 diabetes is lack of insulin production. Insulin production will be very less or almost nil, in contrast to type 2 diabetes. In type 2 diabetes, mostly insulin resistance develop, but in type 1 diabetes, there will not be any insulin production. Insulin production is affected. And all the classical features of diabetes we can see in usually in type 1 diabetes, like 3 P's: polyuria, polydipsia, polyphagia. And almost all main complications, life-threatening complications we find in type 1 diabetes, like diabetic ketoacidosis and non-ketotic hyperosmolar coma. And we know this long-term complications are very familiar and very common, like heart diseases, stroke, kidney failure, foot ulcers, and damage to eyes, and the nervous system damage, like peripheral neuropathy, and it will damage and it will cause foot ulcers and infections, everything. So all these long-standing complications, chronic complications, are very common in type 1 diabetes. And the scope of studying the immunological process or pathophysiology of type 1 diabetes is very important in homeopathy, because we can predict the appearance of diabetes, type 1 diabetes, before any hyperglycemia arises. For that, we have to understand the diabetes-related autoantibodies. We have already seen that beta cells are being destructed by antibodies, and we can detect these antibodies in our body. These are, number 1, islet cell autoantibodies, number 2, insulin autoantibodies, number 3, GAD65, glutamic acid carboxylase 65 antibody, autoantibody. Number 4, autoantibodies targeting the phosphatase related IA2 molecules. Number 5, zinc transporter autoantibodies. So mainly 5-6 antibodies are can be detected in type 1 diabetes. The thing is, these autoantibodies can be detected through blood examination, maybe 3 months to 10 years before the onset of hyperglycemia. Before the so we'll get ample time. In children, it may affect within 2-3 months. If we find that antibody titer increasing, autoantibodies are increasing, then he may get type 1 diabetes maybe within a span of 3 months. But in adults, it may take up to 10 years to develop type 1 diabetes. So we may get enough time. So this is a very good area for the homeopaths to do researches and to establish the efficacy of our medicines by preventing the development of type 1 diabetes, even though presence of autoantibodies have been detected. So those who are interested in research can note this point. And come back to in type 1 diabetes, if these antibodies, if only one antibody is present, then it may not be a risky affair. But if more than one antibodies are present, for example 2 to 3 to 4 antibodies are present, then the patient may get type 1 diabetes 60 to 100% sure. All right. And among all these antibodies, islet cell, for detecting islet cell antibodies, immunofluorescence technique is useful, whereas all other antibodies can be detected through radio binding assays. So that's the important point in interesting point in type 1 diabetes. I don't think in our usual practice many are focusing all these factors. Many are considering all these factors. But we should establish a research-oriented in at least in our higher institutions, we have to plan research projects for this kind of diseases. This I suggest type 1 diabetes will be a good choice for that. Another one is rheumatoid arthritis. This is a state of persistent cellular activation leading to autoimmunity and immune complexes in joints and other organs. Clinical manifestations of disease are primarily inflammation of the synovial membrane and joints and joint damage. So it usually affects the synovial membrane, and it will cause this autoimmune destruction of synovial membrane and the that joint cartilage and the joint itself. And initiation, it has three important phases. An initiation phase due to non-specific inflammation. First, there will be a non-specific inflammation, and in second phase, due to T cell activation and amplification of these symptoms, and in third, it will become very chronic inflammatory stage phase. In this, we can, with the tissue injury, a lot of tissue injuries resulting from the cytokines, interleukins, tumor necrotic factors, and so on. How this can be diagnosed? Immunologically, we can diagnose. I am focusing only the immunological markers, because if we go for all the test of all the diseases, it will be very time taking. So I am just focusing and just to brush up your mind regarding the immunological test important for each disease. So in rheumatoid arthritis, there are two important tests. One is rheumatoid factor, and second one anti-CCP antibodies. Out of this, rheumatoid factor, we know is not at all a specific test for rheumatoid arthritis, because in hepatitis C and in Sjogren's syndrome and in SLE, in these diseases, RF factor will be positive. One thing. Second thing, around 10% of healthy individuals, when we test, RF factor may be positive. So that 10% of individuals remain healthy for throughout their life without getting, without progressing to any rheumatoid infection. So that is number 2. But anti-CCP antibodies, that is the most sensitive test, and is almost specific for diagnosing rheumatoid arthritis, along with the ESR, high ESR, and C-reactive protein, presence of C-reactive protein, etc., and X-ray findings. Next, Hashimoto's thyroiditis. Here, white blood cells and antibodies mistakenly attack the cells of the thyroid. Here the main focus of attack is thyroid gland. Here the thyroid gland is gradually destroyed, and with the autoimmune process against the here antibodies against thyroid peroxidase and antibodies against thyroglobulins. This can be detected, and thyroid gland got destroyed gradually. At the beginning, there won't be any symptoms, and later on, the gland may swell up a while, and later on it may shrink when it got destroyed completely. And general symptoms like symptoms of hypothyroidism and low-grade fever and malaise, such all other features, constipation, all other features of hypothyroidism may develop in course of time. Hashimoto's thyroiditis. This is an autoimmune thyroiditis which causes hypothyroidism, and its diagnosis by measuring TSH. TSH will be high, and T3 will be low, T4 will be low, and anti-TPO and anti-TG, antibody against TPO and anti-TG. These two things can be detected. To establish it as the diagnosis of autoimmune autoimmunity, to establish a diagnosis of autoimmunity, and this is called Hashimoto's thyroiditis. And there is a case came up recently. And another thing I want to tell is this in hypothyroidism, T3 and T4, we have to check TSH first. TSH is the most sensitive indicator in order to find out hypothyroidism, because T3 and T4 may be normal in most of the cases, but TSH will be high. So that indicates the thyroid is getting weaker, diseased, and we may get a full-blown hypothyroidism in coming future. So when we get a high level of TSH, we should start treatment. And of course, this anti-TPO and anti-TG are antibody markers to detect its autoimmunity. Here is a beautiful case. He is a male, age 39, is from India and living in Abu Dhabi for the last 2 years. Came to me on 21/3/2020. He presented with symptoms of tiredness and sleepiness, especially while driving. Very sleepy while driving. That was the most distressing symptom for him since 1 month. And he went to a nearby hospital for a general checkup, and he was found very high TSH. This is 92. Can you see? 92. Ribu, the slide is clear? Ribu is not there?
Yes, sir. Slide is clear. You can continue.
Clear. Okay. So TSH is 92.9. See how much it is increased. And free thyroxine, that's FT4 is just 0.3. It should be up to at least 0.9 or near to 1. So this is only 0.3, and TSH is 92. So the doctor immediately ordered for the auto antibody test, and the result came out as 297. anti-TG. They tested anti-TG. It is 297. So with this, patient became panic, and he consulted many places, his friends, relatives, all utilized all the sources, and they advised, some of them advised to start homeopathic treatment because some of his friends got cured by taking homeopathic treatment. So he immediately rushed to me. And I took the case in detail. There was a lot of beautiful symptoms, qualified symptoms, general symptoms, qualified particulars, bloating of abdomen after every meal, after each meal, whether it is from breakfast, lunch, dinner, and if you take any tidbits in between, like this chips or any other things, or tea or anything, after eating anything and everything, he may get his abdomen, he's getting his abdomen bloated. And another symptom was occasional throat pain from cold drinks, and headache. Headache was another troublesome symptom for him. Aggravation from fasting, 3 mark, and aggravation from odors, 1 mark. And nasal obstruction at night, it's almost significant. And this is for cold water, spicy food. He's very fond of spicy food. And the patient thermal modality is warm. And another troublesome symptom as far as patient side was a lack of timing during sexual intercourse, so quick emissions. And anxiety, that was a very prominent symptom. When I saw the patient, that was the most striking symptom felt to me. He was very anxious, and especially anxious easily about his diseases, about every occurrence, all symptoms. He was very anxious. Whenever he get any pain or this chest area, his thought is directly going towards heart attack or headache. He'll be thinking that whether it is any symptom of cancer, brain tumor, or like that. His thoughts always going to the higher range of diseases. So fear of diseases, has to contact doctors immediately. He is to call immediately doctor, and in order to confirm whether he is having any serious illness or not. In his history, only but this particular history was among the history. Appendicectomy done in 2010. Vitals were quite normal, but BP was coming towards the high end, 131. Being a man of 39, this is considered to be a tendency for hypertension, or maybe because of his panic situation, is 131 or 89. And you might have got some idea. Are you sending any suggestion about the prescription? Can you send some suggestion? What could be the prescription? I will show the repertory chart. I did repertory session for this case, and then only I prescribed. Any medicine, can you message? No suggestions? Okay.
Hello, sir. Can you see the suggestions in the chat box?
Sorry?
Can you see the suggestions in the chat box?
No. Oh, suggestions already come.
Yeah, there is so many suggestions like Lycopodium, Naxworm, Arsenicum album,
Okay.
and Calicar, Argenta nitricum.
How can I
Can
view
you see
this?
the chat box, sir?
How can I view this? Because
Oh, there is an option like more. You just click there and
more.
there
Yes.
will be.
Okay.
Yeah,
Okay.
you just click there, then you can see the chat. Okay.
Recording. Stop
Sir.
recording. Meeting info.
Can you see the
Hide.
suggestion?
Hide. Share. Optimizing. No. Chat. Okay. It was there even first. Okay.
Okay. Did you get it, sir?
Next home. Okay. Calcarea carb, lycopodium, phosphorus, calcarea, phosphorus, lycopodium, calcarea, phosphorus, calicarb. I think some are doing spot repertorization. Most of these medicines are matching to my repertorial I mean this. Okay, I'll show you my report and yes. This is the repertorial chart. All right. So all these medicines are there. Lycopodium emerged as the the medicine having highest score, having 51. Axomica 43. The medicines the rubrics I selected were mind I selected hypochondriasis, and second rubric male genitalia emission to QQ. This radar repertory. This repertory is radar. Okay, and the third one is general food desire for pungent food, and head pain from head fasting aggravation, and abdomen distension after every meal, generals hypothyroidism, and nose obstruction at night. Anyway, lycopodium emerged as the main scorer, and then followed by Naxomica, sulfur, and natramure, phosphorus with the 38 point, calcarea 29. Okay, so since lycopodium scored this much point, we cannot neglect lycopodium, right? So I gave lycopodium 1 I started in 1 potency, 2 doses, and the same day 21. The thing is, he got tested in. You can see that report. Dates are very interesting. He got tested TSH on 19th. 19th of March. 19th of March. Most probably at the result printed on evening of the same day. Most probably doctor might have informed him that he is having very high TSH, so he has to go for antibody test. So the next day itself they took blood for antibody, and meanwhile he rushed to me the very next day, that is 2019 for TSH test, and 19 for TSH test, 20 for antibody test, and 21 he came to visit me, because I already told you he was that much anxious. He was that much anxious, so he immediately rushed to me, and I took all the symptoms and prescribed lycopodium 1. I gave him for 1 month prescription plus SLBT everything. 1 month, no other medicines, only lycopodium 1. But he was keep on calling from the next day consecutive days he was calling day and night, asking about many doubts about his own diseases and how to take this medicine like this and that. Okay, and he came to me on 19th again, and again sit with me and discussed a lot of his problems. The same issues he was telling me again and again, and he was much worried what is going to happen if he is going to lose the thyroid gland completely or not. Like that, he was very much anxious. And I gave some more BT and SL such things, and I sent him back. 16th he came back again, and as such there was no other symptoms except this anxious situation. His symptoms also was almost the same. And in 16th, I again repeated one more dose. Even if he came 5 days before, I told him that I am giving this medicine, but you have to take start this new course from 21 onwards. 21 4 onwards. I missed that date. Okay, and then he came again on 16th 5. I repeated two more doses, and again on 16th, same date he is coming. That is very interesting. 16/6. So it is April, May, June 16th. I gave one more dose. That is third dose of Lycopodium vernum, and then he brought the report for the next visit. He sent me the report on 8th. That was wonderful. 5.887. See, from 92, it dropped down to 5.87 without taking any thyroid hormone medicines, no other medications, only homeopathic medicine. With homeopathic medicine, within 4 months, 3.5 months of lifespan, treatment span, it dropped to 5.87 with the FT4 improved 1.41 and T3 also improved to 0.34, and we are waiting for the immunoglobulin report, antibody report. So see, now anybody can blame homeopathy, anybody can suspect homeopathy. Can we consider this as something like what we call psychological effect or something like that? No, this is a clear-cut indication that our high potency medicine, vernum, now people are going after arsenic alb 30. All are after arsenic alb 30, so-called scientists, and they are counting the zeros present in arsenic alb 30. So when they come to the scenario of vernum, how many zeros will be there? Just imagine, countless number of zeros will be there. So how these zero medicines are acting? So this is a wonderful example how higher potency medicines are acting. Nobody can tell that higher potencies are not acting. This acting in our body in a very wonderful way and bringing out the reports in terms of like this biochemistry report. Evidences are there. With evidences we are speaking. All right. Now we move on to another case, that is Graves' disease. We know what is meant by Graves' disease. Here the immune system creates antibodies known as thyroid stimulating immunoglobulins. These antibodies then attach to the healthy thyroid gland, thyroid cells, and this will cause thyroid gland to produce high levels of thyroid hormones. The exact opposite is happening in Graves' disease. In Hashimoto's thyroiditis, they suppress or destroys the gland and decreases the production of hormones. Whereas in Graves' disease, it enhances it or producing thyroid hormones. So we'll get hyperthyroidism. Again, anti-TSH receptor antibodies. This is a key immunological marker in Graves' disease, anti-TSH receptor antibodies. And TSH will be very low in Graves' disease. That is the hallmark of Graves' disease, very low, 0.002, 0.001, like that. And the T3 and the T4 will be very high. These are the immunological findings or laboratory findings in Graves' disease. And let us go for a case. Before that, one point I have to bring to your memory is most of the Graves' disease patients present with diabetes. I have seen maybe a dozen of patients or more than that during the course of my practice, and most of the time they present with diabetes. Most of them presented with diabetes, number one. And few patients presented with weight loss, sudden weight loss, whatever they eat, finish. They're digesting immediately. Even big hospitals, they miss this diagnosis of Graves' disease. They go after diabetes. So we should be very cautious whenever we see a patient with a sudden onset of diabetes, high diabetes. The cause could be Graves' disease or hyperthyroidism. So we have to write a TSH test and a thyroid profile along with other diabetic tests like TS, fasting FBS and all, HbA1c or something like that. And in Graves, so this should be, we should bear in mind, hyperthyroidism cases may present with diabetes, sudden onset of very high diabetes with loss of weight. Here is a case. He's a male aged 44, again from India. He's living in Alain for the last 15 years doing his own business. He consulted me on 5th October 2019. He presented with a fever. He told me just 3 days there was fever. On inquiry, he told me that recurring attack of fever and weight loss is there since 3 months. It was a clear-cut diagnosed case of hyperthyroidism. At that time, he was in India when it got diagnosed. It was in India, and he went there because his brother was seriously ill. He went there in order to see him, and he reached there and spent 2-3 days with him, and he expired, his brother. And that brother was taking care of all this family because his father already expired, father and mother already expired. So this became a big shock for him, and after that a good number of symptoms started manifesting in his body. And in the beginning he didn't understand that these are because of something serious going on inside his body. Because of the stress he neglected, and when he started losing his weight and started thirst, polydipsia, polyuria, when such symptoms developed, then he did a checkup, a blood checkup, and then he found that RBC was very high. So he immediately rushed to a hospital, and they checked everything, and they diagnosed as him as Graves' disease, and started neomercazole. That is the main this thing of modern medicine, main medicine in modern medicine, and they started neomercazole. But he was taking neomercazole, but fever was not at all going away. he was still getting that fever and weight loss, little bit improvement in weight loss. Weight started getting back, and sugar, diabetes, more or less same. Plus very much fatigue, frequency of urination, all this because of diabetes, and constipation because of this hyperactivity of body, and grief after the death of brother was still there. And by person he was very diplomatic, and he has aggravation from pungent food items, and thermal wise he was amphithermal, and recurrent attack of morning fever and weight loss. That already we have seen. And pressure was also, BP was high. It was 152/94. And this report is not so clear. And I'll tell you, it is 0.01. TSH was 0.01. T4 was 13, and T4 was also 13.3. This was first month report. After giving 1 month of neomercazole, they sent him for a retest. At that time also, TSH was 0.01, but T3 and T4 shows marked improvement, 2.3 and 3.4, like that. Now, what are the suggestions you have? Let me see. Natramur, Aurum iodatum, Natramur, acid force. So good majority opted Natramur. Very good. Okay. So it was very clear from the history. It was very clear. It was clear-cut case of Natramur. And in repertoire totality, it came out. I took the rubrics: mind ailments from grief, fever, forenoon aggravation, throat pain from cold water, stool dry, and jaundice, food aggravation from pungent food. Sulfur was the leading scorer with Natramur. Natramur leading with 36 points, and phosphorus next to that with the 30 points. But they didn't cover 1 point, that is throat pain. And sulfur and arsenic was the drugs which cover all the rubrics. Anyway, I started with the Natramur, and the after this was also before that, before giving our medicine. At that time also TSH was, when he reached Align, I asked him to go for a checkup again, and that doctor also told him that once you reach Align, live there for 1 or 2 months and then go for a checkup and send me the report. And again it was found that 0.005 TSH, it was gone back again. But T3 and T4 keeping almost normal. But the problem was fever was not at all going. Fever was there, persistent fever, and all that mind was still burning, because of that his grief. It was still there. He was very much depressed, and he was continuously telling about all the incidents when he was in his good times with his brother, and everything was coming to his mind, rewinding. He became such a position, he does not want to go for his business. He was sitting at home, wants to be at home, wants to go out, do not want to meet friends. In such a depressed state he was. Anyway, I started Natramur 200, and the fever was, but anyway, immediately after giving Natramur, fever went away. That was a good, promising thing for him, and he became convinced that something is going on, something good is going on. and but BP was same, and RBS was also almost the same. Pressure, both systole, diastole, and pulse was also in a high level. He eventually developed a cough, and I prescribed iodine 30 based on that symptoms. Then after 2 repetitions of Natromur 200, and I went for Natromur 1 So after that, no more fever episodes, but headache started. It was there even before also. He used to get migraine attacks, and now it came back. And he was complaining of headache. It may be probably morning headache. It could be from contributing from hypertension also. Anyway, I give 1 dose of sulfur, and but headache was as such not much relief. And I repeated on 9th. I repeated Natromur 1 again, but still headache was there. Not much relief. Fever anyway gone, but headache he used to get. Could be because of hypertension. Having 44 years, having this much BP, 150 or 90. And I gave a few doses of thyroidinum. With the thyroidinum 200 also, there was not much difference felt. And he came back after 10 days with the same BP. BP was keeping in 150 or 90, that level. And I gave Rolfia 10 drops 3 times in a day. That was against our previous doctors said, sir told us do not give only 2 drops 3 times in a day. He was totally against 10 drops. But after giving 10 drops, BP started responding wonderfully. It became 138, 84, and it became 125, 84, 82. I was also very happy, and patient was very much happy. And when he tested on 6/2, TSH improved to 4.2. In between, they did a lot of tests, but all the reports I am not showing here. In all that report, TSH was 0.001 or 0.0345, like that only. For the first time, TSH became 4.32, and T4 much improved. FT3 also improved. So this was a wonderful case of hyperthyroidism, and they reduced I told him neomercazole dose you adjust by talking with your physician. Then he was also very happy. He was not knowing that he is taking homeopathic medicine also along with that, because that doctor was against taking homeopathic medicine, and this patient was very fond of homeopathic medicine, because right from his childhood he used to take homeopathy only for everything. That's why he came to me. Now neomercazole, they reduced its dosage, and they're planning to stop it. Another case, HS purpura. We know this is IgA vasculitis. This affects small blood vessels, disease of the skin, mucous membrane, and sometimes other organs that most commonly affects children. Children are usually present with HS purpura. In the skin, the disease causes palpable purpura. Purpura, we know, small raised areas of bleeding underneath the skin, often with the joint pain and abdominal pain. This is definitely an autoimmune disease that is often triggered by an upper respiratory tract infection. In this girl also, it happened like that. And its immunological marker is raised IgA level in blood. Raised IgA level, immunoglobulin A in the blood. The whole episode started as abdominal pain. episodes of abdominal pain since 1 month, with vomiting at the peak of pain. That was the main complaint when they came to me. It was a diagnostic case of HS purpura. So the symptom was usually abdominal pain starts in the morning as hunger. Hunger pain, it starts as hunger pain, and then it becomes very severe pain followed with vomiting, a kind of doubling up pain. And that symptom was very peculiar, doubling up. Doubling up caused little relief. Purpuric rashes in legs for 1 day, and history of similar attacks since 2 weeks. History of presenting complaint is very important. The complaint, all these things started last year, September first week, as a severe abdominal pain, and the patient, it's a child aged 8, female. So they brought her to the nearby clinic, and allopathic clinic on September, and they gave some medicines. And September 3rd week, first week started this disease, and the 3rd week she developed purpura. And at that time, that he was a very good physician, and he diagnosed it as HS purpura. And based on the clinical diagnosis, he started prednisolone. What happened was there UTI developed, and this was not, and the doctor got confused, and along with that some bleeding. When blood started appearing in the urine, then the doctor and patient, everyone became panic, and they sent her to the nearby big hospital, the main government hospital in LA, and admitted there. And they treated for UTI. UTI got cleared, and they discharged, and they came back to home. And at that, they visiting me, and they came to me and brought this child to me, and I took this case. And based on the symptoms, tongue was clean and moist, aversion to egg, desire sweets, candy, and the knee chest, he sleeps in knee chest position, skin was very dry, thirstless. So I thought, okay, now it is the main symptoms has been subsided. So I took the case in detail, her in the other features and all, and I better to go for the constitutional medicine. Now anyway, acute symptoms have been subsided. Okay, what are your suggestions? Let me see your suggestion in this case. Ipecac, calcareous, medornum, ipecac, medornum, colosins. Very good. Medornum. Please tell what is the prescription point of medornum in this case. Because of Zoom, we can use it as a bilateral. We can take benefit from both the points, both the ends. Phosphorus is okay. Sleep position, okay. Medornum, sleep position, knee chest position, okay. Very good. Okay. But I did repertorize this case, and the repertoire result was phosphorus came out as the main medicine. Phosphorus with 30 marks, and then came sulfur with 27 marks, belladonna, pulsatilla, lycopodium, sulfur, and so and on. I took generals, food, this desires, aversions, sleep position I also took. Phosphorus came out, and lycopodium, sleep position, sepia, after that calcarea, medornum is not there. That is the problem. Sometimes for this kind of acute prescription, of course, the thing will come to our mind. If I didn't do repetization, I might have given Madorna. But since I went for detailed case taking and in the proper channel, repetization, then phosphorus came out, and we know phosphorus is a bleeding medicine also, good for bleeding. And I started phosphorus 1 or 2 dose. But the result was pathetic. Immediately after giving, in 4th December, I prescribed phosphorus. 7th December, patient again get UTI. They didn't come to me, they went directly to the hospital and got admitted there for 2 days and got discharged on 9th. And then went back home, and 15th, again fever started. UTI started. Another attack of UTI on 15th. Again rushed to the hospital, admitted there, and again discharged after 2 days, 15th and 16th, then discharged 16th evening. And when they come back home, again the whole story started: abdominal pain, vomiting, purpuric rash, and they again come back to me on 17th. Again came back to me. At that time, I noticed 2-3 important points: that abdominal pain with purpuric rashes on legs, and the restless, cannot lie on the same side for a long time while sleeping, especially while sleeping. So immediately I thought of arnica. If any medicines are there on the chat box, let me see. Okay. Arnica, doctor. Yes, you are correct. Mariam Khayyum. You are correct. Then I prescribed arnica. Arnica, it worked really well. I gave Colossin also as SOS because of this doubling of pain. Colossin struck me from the beginning. So I gave 1 drum pills of Colossin and told them, take this whenever you feel that much severe pain. Otherwise, do not take Colossin. Anyway, with the arnica, she responded beautifully. There was absolutely any abdominal pain. Bleeding stopped, no more UTI. First day from 23, 17th I gave the prescription. 23 they reported, and I prescribed 1 more arnica for 2 weeks, 2 more weeks. And they didn't use Colossin. They didn't open even that bottle. And on 8th, again, no abdominal pain, no UTI, nothing. Again, I repeated arnica, 30 itself. And since the case was beautifully acting, going on well with arnica, I didn't change the medicine, and I gradually reduced its dosage and even eventually stopped it. And one thing we should remember in this case is henoxacoline purpura is a self-limiting one. So if we present the same case to another critic, then they will immediately tell that this is a self-limiting. So it went off by itself. So you don't have any role in this, like that they may tell. But the thing is, when we learn curiously the chronology of its development, 100% we are sure that all the happenings, the developments in this scenario, how homeopathic medicine helped that patient, and they are very, very much convinced. And another important thing, in big hospital, they were against treating this case with prednisolone. They stopped prednisolone steroid, and that hospital, they advised, don't worry, if there is pain, and we will give symptomatic treatment, and we are not going to treat you with steroids. That they very clearly they tell. And so that's why symptoms was not reducing. Frequent attack of UTI, purpura, abdominal pain, everything was coming. Child was just only 8 years. So it worked wonderfully, arnica. Another case, this is a very complicated case. This is a case of leukocytoclastic vasculitis. LCV more typically refers to small vessel vasculitis, inflammatory or autoimmune disorders and neoplasms may trigger the small vessel vasculitis. This can include lupus erythematosus, inflammatory bowel disease, rheumatoid arthritis, myeloproliferative disorders, lymphoproliferative disorders, and plasma cell dyscrasia. Raised IgA level in blood is the hallmark. The other case, since the all diagnosis they made in hospital itself, I didn't get their diagnostic points. Only diagnosis was mentioned here, like HS purpura. HS purpura is vomiting, abdominal pain, acute urinary tract infection. Everything is written there. So let us come to this LCV, leukocytoclastic vasculitis. This is a lady, female, aged 38 years. She's a housewife, been in Alain for quite a long time, having 2 children. Husband is a driver. Complaints was small red spots, that is purpuric spots in legs, recurrent attacks since 2016 August, and occasional attacks of redness of conjunctiva. Obviously, it is conjunctival hemorrhage since 2 years, last 2 years. Attacks once in 6 months. This typically it will recur after every 6 months. Redness of conjunctiva, usually from strain or mental or physical strain, and this conjunctivitis coming, and joint pains, aggravation by any strain, and amelioration by rest. Low back pain was there. Patient is typically a warm patient, cannot tolerate heat, very highly emotional, easily weeps, anxious about disease, others, and there is anaphylactic to ant bite. Here it's a very big problem. Unlike in our place, many cases are fatal, and anaphylactic reaction happens from this ant bite. And so people, after getting ant bite, just like in our place, a snake bite, similar to snake bite, they rush to the hospital. And in many cases, they can hardly reach there. That kind of reaction used to happen from ant bite. Plus, this lady's autoimmune disease is also there. So her condition is very critical, since she's having this anaphylactic reaction as well. Periods very late, may delay up to 6 months. Attacks of dyspnea since childhood. Aggravation by odor, dust, cold, and took infertility treatment. Infertility treatment for the first baby. That's also another interesting factor in the history of this patient, because she took a lot of hormone tablets, lot of treatments for getting her first baby, and the second baby born normally without any treatment. So this blood report in urine, bleeding is there, RBC 3+ and RBC count 32. This persistent high RBC count in urine, and 3+, almost 3+, 4+, and sometimes 2, almost keeping 3 and or above that. RBC 18, another test, RBC 18, and another test, it was 12. That was the lowest. Before again 8, 5.9. These are all started after taking our treatment. It gradually started coming down. After taking our treatment, it came down to 8. Then at one stage, it became again 3 plus 7. It came to 7. Again, it raised to 25, 1 point, like that. But this is a very difficult case, and it's keep on following up. Started with pulsatilla 1 and followed with arnica 30, sulfur, terbinth, pulsatilla again, and treatment going on. In this case, treatment is still going on. Your suggestion is very valuable in this case, because I am also somewhat frustrated with this case, really. But patient is very confident. She is telling she has improvement, but at times immediately she get redness of conjunctiva, probably due to conjunctival hemorrhage and hemorrhage in urinary hemorrhage, mostly like this only, microscopic hemorrhage only. And before she used to get acute infections, quite common, but nowadays she is not getting acute infections that much. So in that way, she was happy. And the treatment still going on in that case. But this difference between immunothrombocytopenia purpura and HS purpura. Purpura, there is IgA mediated glomerulonephritis will be there in HS purpura. Mediated glomerulonephritis will be there, yes, could be there, but and that may be the reason for getting that UTA and all. But anyway, that has been sorted out. Now there is no symptoms. Patient is perfectly okay. That patient is okay. Is okay. But now we are struggling with LCV. Indication of what is that? Chininum sulf. Yes, chininum sulf. The case again. Please show the case again. Which case? Mamta, which case? You are asking which case? I'm asking for which case? Indications of arnica. I explained to you. There was patient cannot stay on in one side for long time. She restless in bed, plus this purpura, hemorrhagic spots, purpura, hemorrhagic tendency, plus restless sleep. Because this symptom is very hallmark in everywhere patient lies, that part feels very painful. So they have to change place often. You'll see argentum nitricum. Okay, I will consider argentum nitricum. Ledam pal, you can suggest medicine. I am eagerly waiting for some suggestions in, so that I can try it out. Okay. Ledam pal, argentum nitricum. Case number 4. 4 means LCV. LCV. See, this is the case. Small spots in legs, recurrent attacks since August, redness of conjunctiva, attacks once in 6 months, aggression, strain, mental or physical, joint pains, lower back pain, warm patient, emotional, anxious about disease, anaphylactic to antibite. Is emotionally very much emotional. Patient is very emotional, very sensitive patient. Husband used to cannot tell her anything. She either will weep or go to depression. But at the same time, she is of the nature that she cannot keep quiet also. She used to tell something always with the husband. And he must keep quiet. Husband must keep quiet. That is her attitude. He was telling. But she is very what we call very not workaholic, but since her husband is not having a very good salary, she was doing some babysitting duty also at the same time. She is keeping 2 or 3 kids, managing them, and she's making income in that way. Maybe because of stress. Stress is there. Stress is a very big factor in their life. Economic stress is there. Plus, she is taking physical stress also. She has 2 children and teaching them, and she want good performance from their side in the school. That is her character. I have to study this case in detail anyway. Formica rufa, Aristolochia, infertility. What is connection with here? Aristolochia is given for infertility. It has history of hormonal treatment. Okay, very good, very good. Okay. That point also we can consider, because I think the triggering point is could be there from the infertility treatment. Anyway, now it's a perfect picture of autoimmune vasculitis. Snake group of remedies. Okay. Good ignatia. Ignatia is also there. All these are valid suggestions. Cannot weep to weep, otherwise it's to ignatia. Okay, many medicines are coming. Okay, all right. Now this is let us have a quick revision of some of the autoimmune diseases. Another is Addison's disease. The adrenal cortex is damaged and the adrenal gland don't produce enough of the steroid hormones, cortisol and aldosterone. So we can detect antibodies against the adrenal cortical cells in this case. And inflammatory bowel disease is very familiar and very common. Inflammation in the lining of the intestinal wall. Autoimmune process taking place in the lining. Crohn's disease can inflame any part of the GI tract from mouth to the anus, but ulcerative colitis affect only the lining of the large intestine, colon or rectum. This is another lupus SLE. In SLE, anti-nuclear antibody. Presence of anti-nuclear antibody is the confirmed. And this is a systemic disease, SLE. It can produce any kind of all the features like malaise, fatigue, fever, joint pains, bone pain, muscle pain, everything can be there. In addition to that, it is prone to get secondary infection, maybe pneumonia, nephritis, and fulminant infections. Very troublesome disease. I think one of the it need a separate day for studying SLE. Multiple sclerosis, damage here, the myelin sheath got damaged, which protects the surrounding nerve cells. Damage to the myelin sheath slows down the transmission speed of messages between the brain and spinal cord to and from the rest of the body. And in psoriasis, we see dendritic cells, macrophages, and T cells. T cell which move from the dermis to the epidermis and secrete inflammatory chemical signals such as interleukins and tumor necrotic factors, etc., etc. And these secreted inflammatory signals are believed to stimulate the keratinocytes to proliferate. Here, more proliferation happening. That's how psoriasis develops. Psoriasis is also an autoimmune disease. Yes, that's all.
Okay,
So
sir.
thank you for listening me.
Okay, sir. Actually, it was very informative session, sir. Actually, you give a clear-cut picture about every conditions of autoimmune disease, and also you shared examples of cases and the way you are selecting the rubrics and you getting a single medicine for the condition. I think everything was very informative and very interactive session was it is. Um, and I express my sincere gratitude to Dr. Shajahan to sharing your valuable knowledge, sir. Thank you, sir. Thank you so much.
I am very grateful to be in a IHMA stage. Okay.
Okay, sir.
So we'll stop.
Yes, sir.
Okay. Thank you all.
Okay. Thank you so much, sir.